What's up guys, welcome to another video at Movement Mechanics and welcome to the 7th video of this anatomical journey that we are covering at Movement Mechanics. In this video we are going to talk about two muscle groups, the gluteal muscle which are located at the posterior aspect of the body and the hip flexor muscle which are your psoas which are located at the anterior surface of the body. So we are going to understand as per the traditions, of course, the origin, the insertion and the muscle action of these muscle groups, and at the end I'm going to give you that one exercise for both of the muscle groups which is going to help you strengthen the muscles. So let's dive deep inside this topic and understand some movement mechanics. To begin this video, let's talk about that ass of yours, the gluteus maximus. Now the gluteus maximus is the strongest lower body muscle, and this muscle originates from the outer surface of the ilium, the posterior side of the coccyx and the sacrum, as well as the posterior side of the sacrotuberous ligament. Whereas this muscle inserts at the gluteal tuberosity of the femur and the iliotibial tract. When we talk about the glutes or the glute maximus specifically, the main muscle action of this muscle is hip extension. It is the primary action of the glute max, which is hip extension, and it also does external rotation of the hip joint. These were the concentric muscle action of the gluteus maximus. The eccentric muscle action would be internal rotation of the hip joint, and it decelerates hip flexion. Moving forward from the gluteus maximus, let's talk about the gluteus minimus. The gluteus minimus originates from the ilium between the inferior and the anterior gluteal line, and it inserts at the greater trochanter of the femur. When it comes to the muscle action, it does hip abduction, internal rotation and flexion of the hip joint. When it comes to the eccentric muscle action of the gluteus medius, it does external rotation and hip extension. Lastly, we are going to talk about the gluteus medius. The gluteus medius originates from the outer surface of the ilium, and the muscle inserts at the lateral aspect of the greater trochanter of the femur. When it comes to the muscle action of gluteus medius, it does hip abduction and external rotation as its concentric muscle action, and when it comes to the eccentric muscle action, of course it will do opposite, hip adduction. That means it will decelerate hip adduction and it will do internal rotation for its eccentric muscle action. Now, one of the most important aspects of all the three gluteal muscles is the stabilization of the lumbopelvic hip complex. That is one of the most important part of these gluteal muscles, especially the glute medius and the minimus. These are small muscles, and their main role is of course the internal and external rotation, abduction, adduction, but also the stabilization of the lumbopelvic hip complex. Now these muscles would work in harmony with the core musculature in order to stabilize that hip complex of the lumbar vertebrae and that hip joint. And whenever you see any disparity or any postural issues, you need to work on these musculature in order to solve your postural issues such as the anterior pelvic tilt or the posterior pelvic tilt. Moving from the posterior surface of the body towards the anterior surface, we are going to understand the psoas muscles. Now the psoas are basically the hip flexors of the human body, and this muscle originates from the last thoracic vertebrae and all the lumbar vertebrae, and it inserts at the lesser trochanter of the femur. When it comes to the muscle actions of the psoas, it does hip flexion, it does internal rotation of the hip joint, it extends the spine and also rotates the lumbar spine. These are the concentric muscle action. When it comes to the eccentric muscle action of the psoas, it will decelerate hip internal rotation and it will decelerate hip extension as well. Now moving forward from this vigorous anatomical lecture, I'm going to give you that one exercise which is going to train your glutes and that one exercise which is going to train your hip flexor. When it comes to the glutes, the best exercise to train that posterior muscles is the hip thrust, period. The hip thrust is the best exercise for training your gluteal muscles. And when it comes to your psoas, which are the hip flexors, you should be doing the kettlebell hip flexion or the banded hip flexion, which is a regression of the kettlebell hip flexion. You just need to mimic that hip flexion so that you activate those psoas and train those muscles properly. I hope you have understood the anatomy of the gluteal muscle as well as the psoas, the origin, insertion and the muscle action, and I hope you have loved those exercises which are going to train your hip flexor and your gluteal muscles. So if you have loved this video, make sure to like, the share, the subscribe as well as the notification bell icon so that you never miss a video whenever I am uploading a new one. Also, if you have got any doubts or comments regarding this video or any other video suggestions which you want me to cover in the future, make sure to drop that in the comment section. Till then, see you in the next one.